In this lesson, we will conduct a comprehensive analysis of communicable disease risks, malaria, TB, and HIVs, 2020-2025. Malaria, TB, and HIVs remain leading global health threats, especially in sub-Saharan Africa and Southeast Asia. Socioeconomic, environmental, biological, and behavioral factors drive risk, with children, women, and marginalized groups the most vulnerable. Drug resistance, diagnostic gaps, and health system disruptions, notably from COVID-19, threaten progress. Integrated, targeted interventions and robust surveillance are essential for future control and elimination. Let's now discuss the global epidemiological burdens. CIVAIDS trends 2020-2025, malaria, tuberculosis, and HIVC. AIDS remain leading global health challenges, with the highest burdens in Africa and Southeast Asia. COVID-19 disruptions have reversed or stalled progress across all three diseases, highlighting the fragility of health systems. Sustained investment and targeted interventions are essential to regain momentum in disease control and prevention. Malaria continues to impose a profound global health burden, with an estimated 282 million cases and 610,000 deaths recorded in 2024. Sub-Saharan Africa bears approximately two-thirds of this burden, with children under 5 years of age remaining the most vulnerable population. Despite this alarming scale, longer-term trend data offer a measure of cautious optimism. The disability-adjusted life year daily rate attributable to malaria declined by approximately 4.9% annually between 1990 and 2021, reflecting decades of investment in prevention and treatment. However, the COVID-19 pandemic significantly disrupted essential health services, leading to setbacks in malaria control programs and contributing to measurable increases in both cases and deaths during the pandemic period. Sustaining and accelerating gains against malaria will require renewed commitment to equitable service delivery, particularly across the African continent. Tuberculosis TB remains one of the world's deadliest infectious diseases, with 10.8 million new cases and 1.25 million deaths reported in 2023. The disease continues to rank among the leading causes of disability-adjusted life years lost globally, though progress in reducing this burden has slowed in recent years. The geographic distribution of TB is markedly uneven. Southeast Asia accounts for 45% of the global caseload, followed by Africa at 24% and the Western Pacific region at 17%. The COVID-19 pandemic severely disrupted TB diagnosis and treatment services worldwide, resulting in missed cases, interrupted treatment courses, and increased mortality. These disruptions reversed years of hard-won progress and underscore the fragility of disease control infrastructure when health systems face acute, system-wide shocks. Renewed prioritization of TB programs is essential to restore momentum toward global elimination targets. HIVs. As of 2024, an estimated 40.8 million people worldwide are living with HIV, with 1.3 million new infections and 630,000 deaths recorded in the same year. Eastern and Southern Africa bear the heaviest burden, with the highest daily rates concentrated in southern sub-Saharan Africa. Adolescent girls and young women face disproportionately elevated risk of new infection within these regions. Progress made over previous decades in expanding antiretroviral therapy and prevention services has plateaued in the wake of the COVID-19 pandemic, which disrupted healthcare delivery, interrupted supply chains, and strained funding mechanisms. Service gaps and reduced financial commitments have limited access to testing, treatment, and prevention programs for the most vulnerable populations. Addressing these structural barriers alongside sustained investment in community-level health services remains critical to reducing HIV-related morbidity and mortality in the years ahead. The global fight against malaria, TB, and HIV/AIDS faces renewed challenges due to pandemic-related disruptions. Targeted, resilient health systems and sustained funding are vital to reversing recent setbacks in disease control.